a disease that you see all over the world, and it's been well documented in Europe during the last century, during World War II, in the country where I'm from, Ireland, about 100 years ago. It's very, very well documented, and this is because of a lot of the structural and economic issues around Noma. And I want to really reiterate that Noma is just not an African disease, it's a disease that you see all over the world. One of the really unfortunate things about Noma is that it's under-researched. And the figures that we've got that was in the documentary come from professional estimates from the WHO in 1998 that states 140,000 new cases per year. But the real honest answer in terms of research, we don't know. We suspect there's actually much more than that. And as MSF in Nigeria and in Sokoto, we've been undertaking a lot of research on the disease over the last 8 years. And one study that we undertook in 2 states in the northwest of Nigeria showed that at any one time, up to 120,000 children under the age of 15 could have any stage of Noma at any one time. So the numbers that actually we're seeing, the estimates in 1998, we suspect are hugely underestimated. But the problem is that Noma occurs in disenfranchised, remote communities, those that have lack of access to healthcare. And the problem is, people living in these contexts don't even get to become a statistic. People are dying in the community from Noma. So therefore, a call to action is that we actually need to undertake more research, more epidemiology research, more prevalence studies. We need to understand the burden of Noma around the world. But what I can say is that we do think it is large, especially in these remote rural communities around the world with lack of access to healthcare. Thank you. MSF have been working in the northwest of Nigeria in Sokoto since 2014. And we had actually started to respond to a different outbreak of lead poisoning. And this is when we came across the Noma hospital in Sokoto. And since that, we've been working in very, very close collaboration with the Nigerian Ministry of Health and offering the services to these patients and survivors in the northwest of Nigeria. But from the documentary, I think it becomes clear to you that it's not just pure medicine you treat and you send them home. There's a lot more to do with the treatment of Noma. Yes, of course, you need to treat with antibiotics, you need to eventually have surgery to try to fix the scars of the disease. But also, you can see and you can imagine that how much stigma plays on the survivors of Noma. Just going back to some of Mulligat's story, how stigmatization plays such a big role. So you have to approach the treatment of Noma, not just purely from a medical perspective, but also from a holistic perspective, offering mental health support, ideally offering ways to get Noma survivors integrated back into the community, get them integrated back into society, and get them living the lives that they actually want to live. And this is what the hospital in Sokoto is. It's really like a little haven or an island of healing in the northwest of Nigeria. You do hear stories from survivors getting treated in Sokoto that they thought it was just them. They thought they were alone. And they came to Sokoto, and yet then they found a community of those who are actually fighting this disease. And it gives hope. And one of the big parts of the treatment of Noma is actually giving hope. And that's what we're trying to do in Sokoto in the northwest of Nigeria. But it's not just Nigeria. There's lots of places around the world which are suffering from the same problems. And this is why it's so important now to actually take the experience of Mulligat, the voice that she's using through Elysium, the Noma survivor group, to amplify the survivors' voices, to really advocate for better treatment, research, acknowledgement of this disease, and hopefully, down the line, to eradicate Noma. And the sad thing is, if you Google, and I'm taking this quote from Fidel Stroop, one of the other co-founders of Elysium, who Mulligat works closely with, if you Google Noma, the first thing that comes up is a Michelin-starred #1 restaurant in the world. not the disease which kills hundreds of thousands of people. And that's what we're trying to do. We're trying to change that narrative. And through the work of MoneyCap, they're actually able to achieve that. There's 2 points, I think, for me, and it's very much linked to what has already been said. So the first is that Noma needs to be integrated into other disease activities, such as nutrition responses, vaccination campaigns, and so on. We need to be looking inside the mouths of children at every opportunity. And if we do that, recognize the early stages of Noma, refer and treat as soon as possible. It will save lives. So we need to integrate more and more into other health programs. And the second one is that, and it's come through Dr. Vincent's last point, is around looking at the SDGs and relating that to Noma. We need to get our collective voices together to tell some of the major global health donors that it's not enough just to turn your back on Noma because it's complicated. And I've heard that from major donors that, Noma is so complicated, it's multifactorial, there's a lot of elements to it. It's not like some other things where you give a pill and it's a quick fix. So we need to ensure that the global health community know that the SDGs, if you want to have a kind of something to compare if you're achieving your SDGs, Noma, if the eradication of Noma should be linked to actually if you're meeting your SDGs. So we need to ensure that commitment is there from the global health community and the commitment to actually push ahead with these major challenges, because collectively we have a responsibility to act on this, and so that's kind of my other major call.